What do you think is the most misunderstood aspect of neurological disorders?
Even now, many people think that neurological disorders are untreatable. It is a common misconception everywhere. Neurological disorders are untreatable. If a person gets a neurological disorder, yeah, that is the end of it, and he'll suffer, and at one point of time, he'll succumb to death. Medicine is evolving rapidly, especially neurology is evolving very rapidly. Few neurological disorders might not be treatable, but many neurological disorders are treatable, and we can give good functional improvement for the patient, and even mortality can be prevented. Brain tries to clear all the waste materials which it has accumulated throughout the day during sleep, which is very important in long term because accumulation of such materials in long term can cause degenerative diseases like Alzheimer's. We might be reading about few people who sleep for 4 to 5 hours a day, and how they function is really a mystery. So if we go into the studies part, there are some people with few genetic mutations in whom they can sleep only for 4 to 5 hours a day, and they can consolidate all the things, and they can process the waste of the brain also in that 4 to 5 hours of sleep.
A lot of people meet a neurologist during the most uncertain moments of their lives: a stroke, seizure, memory loss, unexplained symptoms, or a life-changing diagnosis. So today we're going beyond the hospital corridors and medical reports into understanding the person behind the profession. We're joined by a neurologist from Apollo Hospitals, Dr. Ranjith. Hi. Welcome to Beyond the Title. Thank you for joining us today.
Thank you for having me.
Before we dive into your medical journey and understanding your life as a neurologist, I'd like to talk about the journey that brought you here. Tell us a little about your childhood and what made you choose medicine as a career.
I did my schooling, college, intermediate in Hyderabad. So during schooling, I have decided that I should go into science background. It is not that I hate maths, but probably because of the respect doctors get in society, I was more inclined towards science, and also particular interest towards science also made me choose BPC. I mean towards the science side in intermediate.
Right. Okay. Was there any particular moment that made you feel like, yes, I have to be a doctor someday?
I cannot tell any particular moment that have made me choose this background. It is my interest towards going more towards a science background rather than a maths side.
Right.
Yeah. Probably after becoming doctor, after taking up MBBS, then there are moments where I felt that I should take probably general medicine or neurology.
Right. Yeah. Okay. Neurology is often considered the most complex part of medicine. So what particularly made you choose this field?
Out of all the branches, making a definitive diagnosis in neurology is most difficult. It is almost like investigating a case.
Right.
So sometimes the investigations we do, like MRI or nerve conduction studies or any advanced investigations, all of them can be normal. Still, patient might be suffering from a major neurological illness.
True.
So we have to keep evaluating the patient, and a lot of times we need to chase history of the patient. We need to talk with the patient what happened in previous days, past few days, how this problem has started and how this has evolved. So it depends a lot on history taking and also examination. And our decision to go treat the patient even when patient's investigations are normal. So it is a quite interesting field. What I feel, it's a quite interesting field when compared to other branches.
Other branches of medicine. Right. What was the toughest phase you've encountered in your medicinal journey?
I would not tell that it is toughest phase. I mean, when I was doing it, I felt that it is tough, but that is what it has made me sit here today. So my DM neurology, those 3 years, those 3 years, I would tell that it is the toughest phase because I did my DM in Manipal, KMC Manipal. It is a busy hospital. Up to general medicine, we used to evaluate cases up to one level. After coming up and taking residency in neurology, we need to evaluate cases so deeply that we should have quite a good understanding of history taking and quite a good understanding of how to examine a patient, and there are a lot of things to learn. So we used to have a lot of sleepless nights. Then I used to feel I am working a lot, I am getting too much stressed out and all. But as the journey went on, definitely I enjoyed the journey, and those 3 years of hard work, that hard work definitely paid off during my practice.
True. So was there a point where you questioned your career path?
No, I never
No?
questioned my career path.
Okay.
I was quite interested in taking up medicine, and I enjoyed all the time throughout the MBBS, MD, and DM, and post DM. I did a fellowship,
Okay.
stroke and intervention neurology fellowship.
Okay.
So throughout my journey, I never questioned
Okay.
my choice.
What does a typical day in your life look like?
So typical day in doctor's life, I mean my life or most of the doctor's life,
Right.
look like I after getting up, probably I'll give half an hour or 45 minutes to myself by doing some aerobic exercise. After that, we will be going to after completing our breakfast and all, I will be going to hospital. And the first thing we go after reaching hospital is take rounds for my inpatients and critically ill patients
Okay.
in ICUs. And after completing the inpatient rounds, if there are any procedures like I do neuro interventions, endovascular interventions of brain.
Okay.
Neuro interventions means carotid stenting, mechanical thrombectomies, or aneurysm coilings. If any of such procedures are there, we'll complete those procedures, and we'll rush to our OPDs. So our OP will last up to sometimes 5 o'clock, 6 o'clock, or 7 o'clock. So after
Right.
completing the rounds, sometimes we get to have lunch, sometimes probably no.
Okay.
So after completing outpatient, again we go and see our inpatients who we feel that may require additional attention.
Okay.
Then sometimes evening we may have some more patients in our clinic, and end of the day.
Okay. So there is no time that you have for yourself other than the 45 minutes in the morning.
Evening definitely I do have time. After 8 o'clock I do spend a good amount of time with my children and
Right.
my family.
Okay.
Yeah, if they hope if they don't sleep by that time.
Okay.
Yeah, by 8 o'clock they'll not sleep, but sometimes we may go home by 10 o'clock or so.
Okay. So, what do you think is the most misunderstood aspect of neurological disorders?
So even now many people think that neurological disorders are untreatable.
Okay.
So it is a common misconception everywhere, not just in towns or villages. It is a common misconception everywhere. Neurological disorders are untreatable. If a person gets a neurological disorder, yeah, that is the end of it, and he'll suffer. And at one point of time, he'll succumb to death.
Right.
That is what many people think. But
Right.
medicine is evolving rapidly, especially neurology is evolving very rapidly. Making a good diagnosis, making a correct diagnosis is important. And many of the yeah, of course, few neurological disorders might not be treatable, but
Curable,
many
right.
neurological disorders are treatable, and we can give good functional improvement for the patient, and
Right.
even mortality can be prevented.
Yeah, okay. Was there ever a patient story that stayed with you throughout your career?
If I have to choose one, I'll tell one patient came from adjoining town, 1 hour from our 1 hour from Hyderabad. So she delivered a baby, and post delivery in 4 days, she developed a brain stroke.
Oh, no.
So she developed a left-sided dense weakness.
Okay.
So one of my friend there evaluated the patient, got a MRI done, and they found that there was a huge clot in her brain. And stroke and endovascular intervention for stroke, any treatments for stroke are time sensitive.
Okay.
So he took a call quickly and sent patient to me, and quickly we have removed a clot. I still remember that was almost in the December last week. So we have removed the clot, and patient did very well. Some
Okay.
of these patients will roam multiple places, and they'll come after after the patient has become completely disabled. But she has reached our hospital in time, and we could
Right.
recanalize the vessel. I mean, we could remove the clot, and she did very well. And post that she has improved very well, and she got discharged, and she keeps sending pictures of she carrying her baby,
Oh,
because she
wow.
was having left-sided weakness. Actually, when she came, she
Okay.
was having left-side zero power, and she was able to carry her baby, and that was one memorable case.
Right.
And even now she comes to follow up. Actually, there is no need to follow up that patient. She
Right.
improved
Right.
completely.
Right.
But when she comes to Hyderabad, she and her husband makes a point that they'll come and meet
Come
me.
to meeting. So, how do you handle delivering the most difficult diagnosis to your patients and their families?
Uh, in neurology, there are few things. As I told you, there are many things which can be treatable very well, and we can give very good functional recovery to patients. Discussing those things are slightly simple. I mean, they are easy. Whereas there are some degenerative conditions which are not treatable,
Right.
and they are fatal. Disclosing them to patients and patient attenders is very difficult.
difficult.
I mean, discussing to a patient that your problem does not have treatment,
Right.
your problem ultimately you may succumb to death. It is a very difficult thing. So we sit with patients, we sit with patient attenders, and what all help we can do in that situation. Other than treating the disease, there is one more aspect of treating the symptoms of the disease.
Okay.
Like if there is any difficulty in swallowing, what we can do to improve the difficulty in swallowing. If there are any pains, what we can do to improve the pains.
Right.
So in such scenarios, we try to improve the quality of life by addressing the symptoms. And disclosing these diagnoses is definitely
Very
difficult. And yeah, patients and family members will get demotivated, and it might be heartbreaking for them. But we take a lot of time, sit with patient attenders, make them understand, and we'll make them understand that we are part of the journey, and we are there to help them out in every part of that disease.
It does affect you a little mentally, right? Every time you have to break a news like this.
Yeah, it does affect mentally, but I mean, after this 12 years of into MBBS,
Right.
into medical studies, and post that I am into my 8 years of my practice.
Okay.
8 years of practice. By now, initially when I have started my practice, I used to have a lot of difficulty in explaining these things. But later on, I realized that if we can explain to attenders in a better way,
Right.
and make them understand that yeah, we are also part of the journey, and we'll be helping in whatever situation they are. Patients, yeah, they do take some time to digest the things, but yeah, they'll accept it, and whatever help they need, we'll be doing whatever is required.
So far in your journey, what has been the most rewarding moment for you as a neurologist?
Rewarding moment, out of all the neurological conditions, stroke is one condition which is very gratifying to treat.
True.
Patients do come with a dense weakness, dense one-sided weakness. They will not be moving one side, and after we treat, either with an injection, some clot buster therapies, or by pulling out the clot from the brain, sometimes they do have magical recoveries. Sometimes. So if they come in correct time, and if many other things are also favorable, they do have magical recovery. I have told you one such case.
Yes.
And similar case, this gentleman was 65 years old person, and he is retired and leading his life happily, and his only work he does, I mean, which he thinks it is very important, is dropping his grandchildren to school.
Okay.
And when he got this hand weakness and leg weakness, left side, he got his left side hand and leg weakness, he was devastated because initial few days he was not able to lift his hand and leg. Actually, we did mechanical thrombectomy and we have removed a clot for that patient. So it was a successful recanalization, it was a successful procedure. After 1 month, with good medication and physiotherapy, he was able to ride the bike. And it was so emotional for him that he is again able to drop his grandkids. So that is one of the rewarding cases. Yeah.
Okay. Stroke has become extremely common these days, especially even with the younger adults. So why do you think this is happening?
Yeah. Previously, stroke used to be a disease which used to happen in patients more than in people more than 60 years of age.
Right.
But recently there is significant shift, and many studies, even Indian studies, showed that stroke is happening more commonly in people who have crossed their 40s also.
Right.
So most common reasons for this is we are now seeing even metabolic risk factors like diabetes, hypertension, dyslipidemia, obesity in the younger generation also.
True.
I mean, previously diabetes means elderly used to have diabetes or hypertension. Now diabetes, hypertension, dyslipidemia, obesity, these things have started coming even in people who are even 30 years old also we are seeing these conditions, and 40 years old also we are seeing these conditions. And sedentary lifestyles, one of the major reason is sedentary lifestyle, sedentary urban lifestyles. We are also causing increasing the risk of people getting stroke in younger age group.
What are the warning signs should people not ignore when it comes to stroke?
So there are two things. Whenever we get a normal health checkup, people, we might be noticing that they will be some dyslipidemia is there, cholesterol is high, or a pre-diabetic status is there, or blood pressures are on the higher side. These are the common risk factors for a person to get a stroke. So
Right.
when such conditions are identified, definitely these things needs to be addressed appropriately. And other warning signs, the physical symptoms which a person may have before getting a massive stroke is one, people may have repeated episodes of one-sided weakness,
Okay.
or sudden slurring of speech,
Okay.
or may have facial deviation, episodes of facial deviation, or blurring of vision, or they may develop suddenly some swaying to one of the sides. So these are the symptoms these are the symptoms where we have to suspect stroke. And if these symptoms, if someone notices these symptoms, definitely it is the point where we have to go to medical attention, because sometimes stroke can happen like a TIA. TIA means a transient ischemic attack. It's a transient episode where person will get the attack,
Right.
and he'll be fine within 5 minutes or 10 minutes.
Right.
If that is the case, some people will think that, yeah, my symptoms have gone. I mean, there is no need to go to a doctor now.
Right.
No, that means luckily he has got some time to go to a doctor,
Right.
and that is the time a person should go to a doctor and get his checkup done. And based upon the requirement, he should be on blood thinners or other managements.
Right. Can these strokes be prevented?
Yeah, strokes are preventable. There are many many identified risk factors for stroke. So when we come to risk factor classification, we try to classify the risk factors as a one, modifiable risk factors, two, non-modifiable risk factors. So non-modifiable risk factors means stroke is routinely very common in elderly age group,
Right.
and that is a non-modifiable risk factor. Age we cannot reverse, right? So modifiable risk factors are hypertension. If hypertension is diagnosed, we can take some pills and blood pressure
Right.
can be controlled.
Control.
If diabetes is diagnosed, we can take some medication and diabetes can be under control. Obesity, sedentary lifestyle can be reverted. Dyslipidemia, high cholesterol levels can be treated with cholesterol medication. And smoking, alcohol, these things are called as modifiable risk factors.
Right.
So these are the things which we can address to prevent a stroke.
Let's talk about migraines now.
Yeah.
So, how can someone differentiate between a migraine and a regular headache?
So a migraine is a head. According to definition, we diagnose migraine if a person is having episodes for more than 3 months.
Okay.
So most often migrainous headaches are one-sided headaches, but not in all the cases.
Okay.
In 50% of the cases, migraine headaches are one-sided headaches, and it can be preceded by visual aura. Visual aura means many migraine patients will come and tell us that they are seeing some waves in front of their eyes, and after they see such visual aura, in 40 to 50 minutes, they start getting headache.
Okay.
So headache which is preceded by such aura. And many migraineurs will have typical precipitating factors like headache getting precipitated with bright lights,
Right.
and loud sounds, and some smells. Some people will have this irritation towards perfumes, or some people with smells of cooking. And in females during menstrual cycle, headache may come. That is part of migraine.
Right.
So if we are able to identify typical precipitating factors which are causing headache, that can be migraine.
Okay. When should these recurring headaches actually be investigated?
Headaches can be classified into two types: primary headaches and secondary headaches. Primary headaches means headaches that happen because of migraine, or because of stress,
Right.
or because of any non-structural causes. That means patient might not be having any major changes in the brain, but still a person is having headaches because of the chemical changes in the brain.
Right.
Those are called as primary headaches. Whereas secondary headaches means headaches which happen because of serious things like clots, infection, tumors. Those are secondary headaches. So if the headache is associated with double vision, or blurring of vision, or any focal symptoms like some facial deviation, hand or arm weakness, or if it is associated with seizures, or if it is very sudden in onset, or if it is the worst headache of their life,
Right.
Previously, a person used to have migraine, and they know very well how their migraine looks like.
Right.
And now the headache is quite different, and they are having very different pattern of headache. Even that type of headache needs to be evaluated.
Do these primary headaches lead to the secondary ones? Or?
Primary headaches will not lead to secondary ones. Primary headaches can keep recurring,
Right.
recurring, because migraine with age it should come down by itself. Stress-induced headaches like TTH can be addressed by modifying our working pattern, modifying our sleep cycles.
Right.
But there is tendency of recurrence of these primary headaches, but they does not lead to secondary headaches.
Okay. Okay. So let's talk about seizures and
Yeah.
epilepsy. If someone witnesses a seizure, what should they do, and what should they absolutely should avoid doing?
So this is one thing which everyone needs to know, because when a person gets a seizure, in many communities, everyone will have their own way of addressing that patient.
Right.
So most commonly, things done in India or in our state, Telangana, are putting something into their mouth,
Right.
or giving some object to the hand, like keychain or something. They'll try to give to the hand. So these are the absolute things that should not be done.
Okay.
So things which needs to be done are, we should give a adequate space for the patient to breathe, and we must try to place the person towards one side,
Okay.
so that they will be protecting their airway.
Okay.
So, and next thing is, if the seizure did not calm down within couple of minutes, definitely it is time to call for medical
help.
attention.
Right.
And if any objects are there nearby, those objects should be cleared, because seizures will there will be violent movements during seizures. If there are any sharper objects nearer, like a chair, edge of a chair, or any sharper objects nearby, a person may harm themselves. So everything should be cleared,
Okay.
and enough aeration should be there. The patient should have enough place to breathe, and they should be lying on one side.
Okay. What usually causes these seizures?
Seizures happen because of sudden electrical dysfunction in the brain. It is just like a short circuit.
Okay.
So it starts as a sudden electrical dysfunction in one part of the brain, and it spreads to whole of the brain.
Okay.
So it can happen because of genetic epilepsies, or it can happen because of meningitis, like infections of the brain, or tumors, or it can happen because of it can get precipitated because of already the known epileptic. Known epileptic can get seizures may precipitate in those patients because of lack of sleep.
Okay.
Or in people who take excessive alcohol, there are alcohol induced seizures. Or in people who take alcohol regularly and stop suddenly, they may have seizures because of alcohol withdrawal. Or sometimes a person may get seizure because of hypoglycemia, low blood sugars, or it can happen even because of metabolic derangements like low sodium levels. So there are many causes which can cause seizures.
What are some of the biggest myths surrounding epilepsy?
Among all the diseases related to neurology, maximum amount of myths are there on epilepsy only.
Okay.
Because there is a lot of stigma towards epilepsy. People will not come out, and family members or parents also, sometimes they will hide that their children is having epilepsy, and sometimes they will not bring the child to medical attention also. So epilepsy is one treatable condition. If properly addressed, sometimes that individual can live absolutely a normal life without having any seizures in their lifetime.
Right.
So epilepsy should never be hidden. Epilepsy needs evaluation, and with a proper evaluation like doing a MRI, EEG, and going to a neurologist and taking medication regularly. So these things can improve the quality of life, reduce the number of seizures. Sometimes they may make the seizures zero also.
Okay.
And that individual may have a completely normal life.
Okay. Are neurological conditions like Parkinson's disease and dementia, are they becoming more common these days?
Yes, Parkinson's disease and Alzheimer's dementia are becoming more common. The incidence has definitely increased if we see the literature. So the reason might be one, diagnosis.
Okay.
And more number of people are coming to medical attention, people who are having dementia and Parkinson's. And second is because of the treatment to dangerous conditions like heart conditions or brain strokes. the longevity has slightly increased. So as the longevity increases, Parkinson's and dementia are age-related conditions.
True.
At one point of time, about 60 or 65 years, these conditions get triggered. So the number of people who are living beyond that point of time are increasing because of the advances in medical care.
True.
So the number of people getting these diseases have also increased.
So, what are the early signs around these conditions that families should be aware of?
Um, First, coming to dementia, dementia means a issue with memory.
Okay.
So, not just issue with memory, they'll be they may notice that that individual, that person might be is forgetting names of familiar people,
Right.
forgetting the routes of familiar places. He might go out and might have difficulty in coming back.
Yeah.
Sometimes they may have signs may be so subtle. Sometimes they might have difficulty in making a good judgment or calculating money,
Right.
or sometimes even wearing a shirt or a pant and doing a task stepwise. So these are the simple things which may be which we will see in the early phases of the disease before the
Right.
frank dementia comes.
Right.
So if family members notice that the cognitive status of a person has slightly decreased, that means previously he used to remember a lot, he used to have good cognitive status, but recently his ability to remember names has decreased, his ability to do some functions has slightly decreased. There is a point where they should meet a neurologist.
Okay. So now let's talk about stress, anxiety, and burnout. So we often hear people saying, "My brain feels very exhausted." So is brain fatigue a real phenomenon?
So this brain fatigue or brain fog, this has gained a lot of attention after COVID era.
Right.
So people who used to have a long COVID, people who suffered from with COVID for longer duration, they used to have this brain fog. So simply, brain fog means inability to think clearly.
Right.
So inability to think clearly and inability to take good decisions, good appropriate decisions, and having mild confusional state. So this brain fog can happen, or brain fatigue can happen because of one, lack of sleep, two, excessive stress, or three, because of prolonged illness. Any prolonged illness, not just COVID, any prolonged illness. These things can hamper our functionality.
Right.
So anything that can hamper our cognitive status or functionality is usually called as brain fog or brain fatigue.
Okay. Can stress and anxiety, can they trigger neurological symptoms?
Stress and anxiety definitely can trigger neurological symptoms. So the most common symptoms which we see in people who are suffering with chronic stress or anxiety is one, the acute attacks of anxiety can cause symptoms like giddiness,
Okay.
palpitations,
Right.
and sometimes they can cause symptoms like true neurological disorders also, like functional seizures or pseudo seizures. Because of severe stress or anxiety, people may develop somatoform disorders or somatization disorders, and they may develop something called as pseudo seizures. Actually, people will not be having seizures, but they will have
Okay.
seizure-like episodes.
Right.
And fainting frequently, and getting hyperventilation, followed by
Right.
some tonic posturing of hands, followed by fainting. These are the acute anxiety attacks. These are what acute panic attacks can cause, which may
Right.
mimic a true neurological disorders. And chronic stress and chronic anxiety can mimic some conditions like a true dementia.
Okay.
So people will not be having true memory issues, but because of chronic stress or chronic anxiety, they will be having something called as pseudo dementia. People will not be able to remember. They come and
Remember
complain
things.
that we are not able to remember few things. A 30 years person will come and tell that I am not able to remember anything. Means that is not because of Alzheimer's or anything. That is
Right.
because of their lifestyle. That is because of the chronic stress they are taking. This pseudo dementia can be addressed by addressing depression, stress, and anxiety.
So, how can someone differentiate between a stress related issue and an actual neurological disorder?
History is very important. History
Okay.
is so important in any neurological disorder or any psychiatric disorder. History is very important.
Right.
So we should dig deeper into the history, and we should be able to identify any precipitating cause for that event. So when a person comes, and examination is very important. So when a person comes and tells that they are having memory issues, so first we try to see what is the patient age. So if does the patient really fit into age group of getting a dementia?
Right.
And no, patient is not fitting into age of dementia. Then is the patient having any secondary headache features? Because sometimes even tumors and such things can also cause memory issues.
True.
And if those things are not there, is the person having excessive stress? How is his work life? And how is his family life? We try to take history regarding his
Lifestyle.
lifestyle and
Right.
day-to-day activities. So with the help of the history and good examination of the patient, we'll definitely able to identify whether it is completely a stress-induced cause or a primary neurological illness.
Right.
Anyways, we do have investigations like MRI if we have doubt, MRI, CT brain, EEG if we have doubt. But before that, history and examination is most important.
These days, whenever we go to a doctor, any sort of doctor, the first question they ask is, how is your food intake and are you getting enough sleep? So, how important is sleep for our brain?
So sleep is very important for brain. So it's very important for our brain health. So in sleep, there are two things that happen to our brain. One, brain tries to clear all the waste materials which it has accumulated throughout the day
Right.
during sleep, which is very important in long term because accumulation of such materials in long term can cause degenerative diseases like Alzheimer's.
Right.
And second thing is brain tries to consolidate all the things which we have learned during the daytime. So it tries to consolidate and tries to store. So say if you don't have any sleep, you have read very well in just before the exam. If you don't have any sleep, probably you may have difficulty in recollecting the things because the consolidation will not happen. And it tries to process the emotions that has happened throughout the day, and it tries to process all the information and store it in the brain during the sleep.
Okay. So, what happens neurologically when a person consistently gets only 4 to 5 hours of sleep a day?
See, 4 to 5 hours of sleep per day is actually not at all enough for a person. Definitely, a person should sleep for 7 to 8 hours a day. There are few people, we might be reading about few people who sleep for 4 to 5 hours a day, and how they function is really a mystery.
True.
So if we go into the studies part, there are some people with few genetic mutations in whom they can sleep only for 4 to 5 hours a day, and they can consolidate all the things, and they can process the waste of the brain also in that 4 to 5 hours of sleep.
Right.
But routinely for a normal person, yeah, definitely 7 to 8 hours of sleep is must.
Mandatory.
Yes.
Right. So, what are the signs that our brain is not getting enough rest?
So our brain, so in two ways, brain may not get rest. A person might be chronically insomniac, or because of some reason, that person might not be sleeping at night properly because of the work or so. Or the second thing is probably he might be going to sleep, but not getting good quality of sleep. Sleep has an architecture.
Right.
A person should go into a drowsy state. Person should go into a NREM sleep and a REM sleep. So the sleep architecture should be maintained. Patient should go into all these phases and come out. If a person is having some diseases like obstructive sleep apnea, these deeper phases of sleep may not happen, and even though they may feel that they have slept throughout the day, they may wake up in the morning and feel that they did not get a good amount of fresh sleep.
Right.
So in such scenarios, person will be having sleepiness throughout the day, or may wake up with sleep and will have difficulty in making a good call, good judgment,
Yeah.
and will have mild memory issues or a confusional state. You can think something called as brain fog throughout the day. So that is
The
what
overall
happens.
functionality gets
Overall
affected.
functionality gets affected and productivity gets affected.
True. So, what's that one sleep habit everybody should adopt immediately?
One sleep habit, I'll tell you a couple of sleep habits.
True,
So for one thing is, don't take any stimulant
Okay.
10 hours before to sleep.
Okay.
So like coffee, tea, or cool drinks which have caffeine, don't take this 10 hours before to sleep. And don't eat anything or take alcohol 3 hours before to sleep.
Okay.
And don't do rigorous mental activity like doing some complex arithmetic calculations just 2 hours before going to sleep. Is definitely a person, that person will not get a good amount of sleep.
Right.
And the other thing is, when your alarm hits, that is a point where we should wake up. So these are called as steps of sleep hygiene. So if we follow these steps of sleep hygiene, usually sleep pattern will be very good.
Right. So many young adults complain about forgetfulness and memory loss. So what's actually happening in these cases?
So young adults, when they come with memory loss, not all first they'll Google and come and they'll decide on
Right.
the disease that they are having Alzheimer's. So Alzheimer's does not happen in younger people. Very, very, very so rare that we can almost think that it does not happen in the younger people. Most often it is because of depression, which may cause a condition called as pseudo dementia, which actually appears like dementia, but it is not a true dementia. Second, stress and anxiety and poor lifestyle. So these are the things because of which a person may develop memory issues. So if we can address the stress, anxiety and the depression,
Right.
the memory issues will improve significantly. Whereas in
Okay.
Alzheimer's disease, we can only help that patient just mildly symptomatically, but we will not be able to cure the disease.
True.
But if we are able to identify the precipitating causes for memory issues in younger individuals, which most often is either stress, anxiety, or depression, we can address the memory issues completely. Or one more thing, memory issues can happen even because of some vitamin deficiencies like B12 deficiency,
Okay.
thiamine deficiency, or hypothyroidism. So even these things needs to be checked when a person comes and frankly says that they are having memory issues.
So at what point should these memory issues in young adults actually become a concern?
See, it all depends upon the history they give and the functional impairment they are having because of these memory issues. When someone comes and tells that now and then I am forgetting things, that too when I am multitasking I am forgetting things. If someone comes and tells, we don't mind evaluate. I mean, we will not evaluate that case.
Right.
And we'll tell that don't multitask. And our brain is not actually our brain cannot multitask. I mean, some people it can multitask to a level, but it cannot multitask. Or if a person is having stress, we try to tell that it is because of stress. But if there is significant impairment of his functional status,
Right.
or day-to-day routines because of the memory issues, definitely we do try to evaluate that patient.
Okay. So what daily habits can actually improve memory and cognitive function?
The daily habits that can improve memory are two things. We can take it as two things. One, physical activity like aerobic exercises.
Okay.
So many people think that these aerobic exercises like walking, jogging, cycling, this can help in cardiovascular health.
Right.
But that is the thing which will help in even cerebrovascular health.
Okay.
So brain health also.
Right.
And second thing is cognitive status, memory, and especially memory for improving the memory or for maintaining an intact cognitive status. There are many studies which have shown that learning a new language or learning a new instrument like some musical instrument, or learning anything which we don't know previously.
A new skill.
Yeah, a new skill. Yeah, a new skill that can rewire our brain and that can stimulate our brain in a very good way.
Right.
So these are the two things which can prevent a person from going into dementia.
Okay. So we have a lot of brain training apps and all these days. Do these actually work?
See, to be frank, when one person came and asked me in OPD, then I did some research regarding this.
Okay.
Even I don't know that whether they will work or not previously.
Right.
So, but there are actual studies which have shown that these brain training apps did not show any significant improvement in cognitive status, in preventing dementia or improving the memory. The things that were proved to improve the memory and that were proved to prevent dementia are aerobic exercises, as I told you, and learning this new language or a new skill. So this brain training apps, I did not go through those apps actually, but they don't have any significant impact on memory or cognitive status.
We'll do a rapid fire now.
Yeah.
So one brain habit everybody should adopt, and one brain habit that everybody should stop doing immediately.
So one brain habit everybody should adopt is, I would say that it is aerobic exercises.
Okay.
Daily, at least 45 minutes of good brisk walk.
Okay.
That is one thing. And second thing, if you ask me, I would tell that keep reading books or keep learning newer things.
Okay.
And one thing that everyone should avoid is, I'll tell you two things. One is inappropriate or inadequate sleep, and second thing is sedentary lifestyle.
Okay.
So these are the things which harm brain most.
So, what to do when people are actually facing sleep issues?
So sleep issues, when a person is having sleep issues, what is the exact reason? It is a simple question, but the answer is very
Complex.
complex.
Right.
Why? Because why the person is having sleep issues? Is it a initiation problem, or is it maintenance problem? I mean, is the person having difficulty in going to sleep, or
Right.
if the person having difficulty in maintaining that sleep, or is the patient having sleep issues because of the stress and anxiety he is taking throughout the day,
Right.
or some people will be simply taking coffee at evening 6 o'clock and they'll not be sleeping. And when we dig into history, how many ever times we ask, they'll not tell that they are taking coffee even at the evening 6 o'clock or 8 o'clock.
Right.
They'll not sleep. Based upon the history and based upon the reason for their insomnia, treatment will be there.
Right. Question is for coffee people. So, when should they have their last cup of coffee?
I would tell that before 2 o'clock. I mean, not 2 o'clock. If they are sleeping at, I would tell that before 1 o'clock. 1. So,
Okay.
coffee has long half life actually.
Okay.
We think that coffee works only for a couple of time, couple of hours,
right.
but it is not like that. Coffee actually works for nearly 6 hours to 8 hours, in some people even 10 hours also.
Okay.
So people tell that before your uh, um, uh, 10 hours of going to sleep, it is best to take the last cup of coffee.
Okay.
And number of cups should be limited to 2,
Okay.
not more than 2.
2 per day.
Yeah,
Okay.
2 per day probably.
So, what's that one brain habit that you do to keep yourself or your neurological health intact?
So you're asking about me?
Yes, one
So
person.
from my side, yeah, I don't try to learn new languages and all, but one thing I try to do is reading books.
Okay.
Not just medical books. I try to read different types of books.
Okay.
So reading books is one very good habit that will keep our brain intact. Actually, I mean cognitive status intact and keep our brains very sharp. What I do is, other than this aerobic exercise, reading books.
Okay. So, a neurological myth that you would like to eliminate forever?
Neurological myth is a people have this umbrella opinion that neurological diseases are not treatable.
True.
Any neurological disease, go to a neurologist and get it evaluated. Sometimes if you get a proper diagnosis, it can be completely treatable also. Even in few occasions, some diseases might not have exact curative treatment, but neurologists can give you some symptomatic relief and guide you in how to try and guide the patient and patient attenders how to cope up with that disease.
True. And are these disorders, do they pass on? Are these like hereditary or something?
So many neurological disorders, in that way, many, even the cardiovascular disorders, your renal disorders,
Right.
there are many conditions that are hereditary.
Okay.
So hereditary neurological causes are a separate subset of diseases which can go hereditary, and some are completely idiopathic. Idiopathic means they does not happen because of any previous history.
Right.
So
Okay. So you spent years learning one of the most complex organ in our body,
Yeah.
which is the brain. So what's the most interesting thing that you've learned about it?
So brain is a supercomputer.
Okay.
It controls each and everything in our body.
Right.
And medical education actually does not end at our PG or post PG level. We keep on learning things. Even practitioners who are at the age of 65 or 70 years also, they tell that they keep learning new things every day, and
Right.
every patient teaches us a new thing. So and we should be open enough to learn new things, and we should be open enough to accept the newer developments which are happening in the medical community.
Right.
And one thing that I have learned throughout my practice is neurological disorders definitely take some time for improvement. So we should have a lot of empathy towards patient and even the patient attenders, because
True.
they are the people who are giving care to the patients.
Right.
And they'll be having a lot of caregiver burden. So they'll be having hundreds of questions. So one principle which I try to follow is, even if that person is the 100th patient you are seeing on that day, even if it is the 100th question by that patient,
Right.
we should answer it like our first question of that day.
True.
So we should have a lot of empathy towards the patient, and even the doctors, of course, patients and patient attenders, they should more than the patient and patient attenders. From the neurological perspective, we must have a lot of empathy towards the patient and a lot of patience also
True.
while we are treating these diseases.
Okay. So it has been a wonderful conversation. Thank you for coming down today.
Thank
Thank you
you.
for your time. It's been very insightful.
Thanks,
And
Aashritha. Thanks for
thank you.
calling me here.